Hi everyone, I'm Dr. Sally Foote, and welcome to today's Facebook Live. Today I want to talk about how to reverse white coat syndrome, or how to stop white coat syndrome. Now, a recent study was done at a Midwestern veterinary college. It was just published in Clinician's Brief that came out today. And in this survey study, it was comparing, do clients find the credibility or which attire do they like better in the doctor, scrubs versus business casual. And in that write-up, what it actually pointed out was that when the doctor wears a white coat over either kind of attire, that's what really increases that credibility to the client. They really, oh, you're the doctor. They really know you're the doctor. So wearing a white coat is important, and especially for our new graduates, especially for the young doctor who's just coming out, starting their career, where oftentimes they're feeling a little bit challenged for people to really believe they're the doctor compared to somebody old like me. So wearing our white coat's important, yet we're having a big, white coat syndrome does happen in veterinary medicine. And the reason why is, if this coat distinguishes, I'm the doctor, and now I'm going to feel that ruptured cruciate ligament, now the not fun stuff happens, giving injections, etc. Of course, they're going to associate more fear and anxiety with the white coat. But we can reverse this. We can stop this. And how do we do this? Doctors, you must be involved in directly rewarding the animal the moment you show up. In my practice at Oka Veterinary Clinic for 30 years, when I showed up, the animals were the happiest. They would literally jump on the exam table. They would come right up to me. They'd stand ready for exam in a relaxed state. And why? Because as soon as I opened that door, I was tossing the rewards to the animal, and all of the best, most highly valued rewards were saved for when I was in the room. This is really the important factor. Do not give the best treats, etc., real heavily by the assistant and technician staff before the doctor shows up. You want that saved for the most difficult person to be in the room for that animal, and that's the doctor. So that's the number one thing. Save the most valuable rewards for the doctor to give. That's how they make this association that the person in white is actually pretty decent, okay, even when we're doing stuff that's not so decent. Now the second thing is the timing. So I'm going to show you, I'm going to just kind of step off camera to kind of walk out or walk through exactly how the doctors need to be delivering reward to the animal so that the moment the doctor shows up in that white coat, now the animal says, oh, the good person's here, or okay, now the best is going to happen even when I may be receiving an injection or something that's really kind of difficult. So let me just walk off the camera here, and this is what I want doctors to do. Pretend I just opened the door and I start tossing. I've got food in my pocket. Doctors, you always have highly valued rewards cut up to the size of a piece of churro in your pocket. Just open the door, and now I start tossing on the floor to these, you see the stuffed dogs down on the floor. So this way, the action of opening the door and I just appear, and I am in my doctor attire, wonderfulness is shooting at them. Don't wait for the animal to come up to you. You're testing out, are they that anxious or not, just as my appearance? Now, if this animal won't eat and turns around and goes away from me, I say, okay, white coats are too much for you. I will leave and I will take off the white coat. And as soon as I come back in, I am doing the same action, immediately rewarding the animal, toss the reward to the animal. So they're at least positively conditioned to me without the white coat. And then we get on with the exam, and I am always delivering the best rewards. Now what I will do is ultimately leave the white coat laying in the room, and then I may put on the white coat periodically. And the reason why is that oftentimes our pets need to go to different clinics, not just my clinic. And they're going to go to a university or a referral hospital. They may go to an emergency clinic. And quite often, and as it should be, because again, of the human, the owner's perception, and we need to know who is the doctor, the white coat still distinguishes us as doctor. So I want that dog or cat to be conditioned positively to the white coat. Avoiding it is helpful, but let's really make the white coat where the best stuff happens, and that's how you can stop white coat syndrome. Thank you very much. I will be posting this video up on my YouTube channel. My YouTube channel is drsallyjfoote.com. Please like and subscribe to this Facebook page. I do the Facebook Lives every Wednesday. I'm kind of trying out shorter Facebook Lives. I found out like these algorithms and things sometimes go for the shorter video. And then check out my website for free handouts, resources, on-demand continuing education. And here at the Bella Behavior Learning Center, I am having in-person workshops as well as live stream workshops on puppy behavior certification, aggressive and anxious dog and cat handling, as well as the fundamentals of low stress handling techniques combined with our examination, nursing care, and diagnostic techniques. Take care, everybody, and have a great week. Thank you.